Good evening. I'm Karen Swartz, the director of the Adolescent Depression Awareness Program. I'm so glad you're here to join us this evening for this webinar. This evening, we're going to be talking about the stresses of a new normal. With so many things that have been changed for the last 18 months, when we're trying to get back into routines, I think we have the challenge of trying to sort out what is now going to be our new normal. So this evening, we're going to discuss the stresses associated with returning to school and former routines, particularly for students, but also I want to say for parents. We're going to talk about potential challenges of change that anyone would go through with change, and also the kinds of people that have more difficulty with change versus those who embrace it and enjoy it. We're going to talk about the body's response to stress, which is unfortunately quite relevant right now. And then I'll finally talk about when a student's reaction to stress and change is problematic and probably needs more formal evaluation and maybe treatment. So what are some of the challenges with returning to school and other routines? Well, obviously, this is all a challenge because we're dealing with COVID. And when we planned this in the spring, we set out our year-long webinar topics. I really thought we'd be talking about something else. I thought we were going to be talking about getting back into much more normal routines, but then we have the Delta variant. As I said, anything that's a change is hard for some people, particularly hard for those who are more introverted and where they like routines. But I'm going to make the point a couple times that when we've had 18 months of doing things differently, we're not resuming anymore. At this point, we are establishing new patterns, or we're dealing with new ways of doing things. And then, of course, all the schools are having new and different protocols. And there's some right balance for every student, whether that's in-person learning, which in many ways has great benefits, or that might be a hybrid model or doing some, for some students, being remote. And I'll talk a little bit about the positives and negatives. So with COVID, the main thing we have to talk about is infection control. Obviously, we do not want the students getting ill when they go back to school, even with all the benefits of in-person learning. I think we all expected to be past the infection risk with this pandemic by now, but unfortunately we're not. So we have to be serious about that. We started talking about, of course, everyone's going to be back in the school in the fall, when during the late spring, early summer, we're making so much progress with reduced cases. But Delta has obviously changed this in that we're now trying to come up with a compromise of getting students back to in-person learning because of all the benefits, but doing it in a safe way. And that often involves masking or other kinds of protocols that make it challenging, or that someone in the class gets ill, there has to be a quarantine period for students that have had close contact. So this is all pretty stressful for parents, students, teachers, for everyone involved. So here's the awful Delta variant. And what we know about it is that it's more contagious. There's a very high risk of quick transmission among the unvaccinated, which we're seeing all over the country. The vaccinations certainly give protection against the most serious illness and death. But the vaccinated people can still transmit. And so we're not quite at the, oh, once you do this, you don't have to worry anymore, nor do you have to worry about your younger brother and sister, or, that teachers don't have to worry about the younger students are taken care of. And of course, we have our youngest students that are not eligible to be vaccinated. So what do we need to safely return? And schools are back. I understand that. We're mid-September. Most schools are back in person. That's what we're going forward with, which is great. The guidance is being developed and it's being changed. I'm sure that this is very challenging for parents to have things switching on a regular basis as we learn more. Masking and social distancing is a part of that for almost all schools. And there's a lot of thought about how large can classes be, how many students can be together. The days of huge pep rallies and assemblies indoors, I doubt that's happening much, or at least I hope as a doctor it's not. And I'm simply going to say this, and I'm happy to answer questions, but I'm a medical doctor and a psychiatrist. Vaccines are clearly the safest way to go forward. And what we're trying to do is go forward. So let me talk now about change. Now, I have a statement here, change is always challenging. It is. Sociologists determined years ago that some happy things, like having a new child, getting a new job, are almost as stressful as the negative aspects, losing a job or getting a divorce. And so I think that ends up being really important. So I've said this, there's no returning to the usual. We've had 18 months of bizarre. So we're now in the new normal. But this is a really important point. We are asking students and parents and teachers who are already stressed, and they're stressed and sort of pulled to the limits from 18 months of dealing with the pandemic to now take on something new. It would have been hard enough. I mean, it was hard enough 18 months ago when they said we have to do something new. This is much more serious than we anticipated, et cetera. But now we're tired, and all these changes are happening to a group of people who are tired. So what influences how we deal with change? One thing is whether it's expected or unexpected. So the good thing about the most recent changes is that on one level, we knew, okay, we're going to go back to school. What do we need to do? We've learned things. We're learning more about what we have to do to be safe. Another is whether it's short-term or chronic. A lot of people say, look, I can do anything for a short period of time, but if you're telling me forever, I'm wearing a mask in school forever, which I certainly do not think medically will be what we need to do, but short-term or chronic. And whether it's a choice or whether it's imposed upon us. None of us would be choosing to be going through what we're going through now. So there is this element of somewhat unexpected. Some parts are expected, but unexpected. It's been chronic by now and it's imposed. All of these things make it harder to deal with change. Now, Hans Eysenck was a psychologist who talked a lot about introverts and extroverts. Now, most people, when they think about introverts and extroverts, they think about friendly people and shy people. It's much more complicated than that. When he talked about someone being extroverted as it relates to change, he talked about someone who lives in the moment, who's all about immediate gratification. Am I having fun now? Who seeks rewards, wants to do something to be excited and have something exciting happen to him or her. Who also has very quick emotional responses. So someone can go from being very upset to happy or from happy to upset very, very quickly. Now, the downside of all this, because that might seem, great, you're living in the moment, you're having fun, someone can get very easily bored. But as it relates to tonight's discussion, extroverts are better able to embrace change. Something new and exciting is welcome. Now, introverts, and I say this as a friendly introvert, introverts are much more future focused. You can delay gratification. You don't want to get in trouble. So instead of going for rewards, you're trying to make sure you're not disappointing anyone, getting in trouble. Emotions tend to change more slowly, but once they change, you're stuck. One thing I'll say about introverts is that we know how to hold a grudge. Like you get a feeling and it's hard to let go. But a strength is, I would say, that you're not easily bored. But change is very challenging. New things are anxiety producing in a way for most people that are more introverted than they are for people who are more extroverted. Now, to me, the most classic example of introverts and extroverts comes from my childhood. And as a Pittsburgher, I'm a giant fan of Mr. Rogers. And so if you remember Henrietta Pussycat and X the Owl, this is actually a quote from the very first episode of Mr. Rogers ever, where Henrietta Pussycat says, "Change, meow, meow, hard for me, meow." So what she's describing is this little interchange that everything has changed and that she's overwhelmed by it. And I think when you're thinking about your own children, your students, just know that some of them are like, oh, this is what we're doing now. Okay, good. Whereas others are going to say, I can't do it. It's too much. I've been having to do too many things differently. Now, one thing that I think is important to remember is that almost everyone finds it quite challenging to understand styles that are different than their own. So extroverts understand extroverts and introverts understand introverts. Now, this is interesting because lots of very successful long-term partnerships, whether they be romantic or marriage or work partnerships, are balanced because they match an introvert and extrovert, but there's a lot of miscommunication and misunderstanding. And I think in my experience as a psychiatrist, when you have a very extroverted or introverted parent and a child with a different style, sometimes you just think, I do not understand what my child is thinking or why she made those decisions, etc. So just something to think about. So what are some of the challenges with school? With the structure, there are challenges just from that. Are we going to have the same plan for everyone? Should we? How flexible can the school be? How flexible can the parents and students be? Should we have hybrid models that we're going to somehow control numbers? And should we have schedules that are more flexible? And this is all, these are all things that are going on. So I'm going to let everyone know what we're going to do is, because of the nature of the way Zoom puts up the slides, I'm going to go through the presentation. At the end of the presentation, there's going to be time for questions, and I'll be happy to take your questions then. So what are some of the benefits of in-person learning? Well, we know what these are. Socialization. The students can actually be with each other. It's all the fun things that you have from walking to class or actually having a few minutes before or after, having lunch together, those kind of things. Being part of a community in a way that I don't think remote learning contributes to. Having a very clear start and end of the school day, and it being a better environment for some to learn, not everyone. Much easier access to teachers because you're having that daily interaction in person. And just some things are hard to learn by Zoom. Some things are hard to teach by Zoom. I'll say that as someone who teaches in the med school. There's some things that are just easier and some that are really hard. And if you're doing group work, which is an important part of school, learning to work together, work in teams, that's quite challenging, I think, to do remotely. But there are benefits of remote learning, right? That there are, main one is decreased risk of infection, which we worry about now. And this is important given the topic where we're talking about anxiety and depression tonight also. There's some decrease in social anxiety for some students where actually being in school is difficult. Now, for some of those students, going to school is of a great long-term benefit because they get exposed, they practice. And if they have been home not interacting with other students, they can be really out of practice. So this going back might be super anxiety producing. And some students really have benefited from there being increased support from family. Although this has been very challenging for parents. I've heard from so many parents because they're trying to balance so many things and do a good job of so many things. So as I said before, all these changes, all these new things, all this new way of doing everything is happening to students who are already stressed and dealing with many different challenges. So we want to be kind, have grace, and be supportive. Now, let me just take a step back and talk for a minute or two about what it's like to go through a disaster and how we respond to that psychologically. Anytime there is a disaster, and that could be a hurricane, that could be any number of things. It's not that it's only something like a pandemic, that when you have that, you end up, this little orange line is tracing along, right, where you start. And then there's this idea that something happens. And when something happens, there's a dip and people have a drop in how they're feeling psychologically. But then there's a rally. And I would say that's what happened more than a year ago. So in March 2020, April 2020, we can do it. We're going to respond. We're going to take this on. That's certainly how it was in the hospital. And that goes on for a while. And then people get tired. And as they get tired, their energy goes down and the general good feelings go down. Now, here's the tricky part about this pandemic. We've now had multiple ways where we've gone through this. So the level of how demoralized and exhausted people are keeps dropping. And then we're also dealing with the fact that we are dealing with what we call a disaster of uncertainty. I have to figure out how to get rid of those. A disaster of uncertainty. And so, there we go. What that does is combine something that's potentially lethal, like COVID is, right, with something that goes on for a long time, with not being too sure about the details. And the reason I'm bringing this up is that disasters of uncertainty, without question, have the greatest psychological consequences. People have more stress, they're more likely to develop anxiety, depression, PTSD, other kinds of serious psychological consequences. So what are the potential health consequences of adding more stress to stressed people? Well, they include, and these are from former studies, increased blood pressure, impaired immune response, which is the last thing any of us need now, anxiety and depression. Because what happens? What is the stress response? When we undergo stress, when we're in a stress mode, there are a whole cascade of hormones that get released that finally lead to the adrenal glands that sit right on top of your kidneys, releasing adrenaline, epinephrine, norepinephrine. So your stress hormones, your fight or flight hormones come out. So then what happens? You go into a sympathetic nervous system fight or flight response. So think about this. This is how you would react if you were on the Washington Beltway and a big truck tried to hit you, right? You go into fight or flight mode. Or if, you're running away from a dog or something that's trying to bite you, you go into this fight or flight mode. So what happens to your saliva? You have a dry mouth, your heart rate's going fast, your lungs dilate so you can run faster, you're responding, which is the complete opposite of the parasympathetic response, which is the rest and digest mode. So this is running away from danger, and this is sitting on the couch after a giant Thanksgiving dinner and not being able to move, because there essentially all of your blood, it's not in your arms and your legs, it's in your body and your GI system, so that you can literally rest and digest. But this is not, it's great that we have the capacity to respond this way. Being able to respond this way gives us protection, but it's no way to live for months and months and months, which is what's been going on. So how do we manage change? One is to manage expectations. Think about what you can and can't do, and having more reasonable and gentler expectations of yourself and of your children and of your teachers and of everybody. Understand that you are going to need to make changes, because when things change, you can't just keep doing what you've been doing. That will not be successful. Find the supports you have and the resources that you can use, and then also using relaxation techniques. Resilience is what we're trying to build, right? And resilience is that ability to rebound. When something stressful happens, that you manage it, that you don't get crushed by it. So you essentially bend but don't break. And I'm going to talk about a few ways that you can build resilience. One is through positive psychology. Now, this is an idea that was started and really championed by Martin Seligman. And he said, I want to not focus on the negative. I want to think about positive experiences, positive character traits, people's strengths. And then I want to think about the kinds of things we can do to cultivate these. Are there institutions to cultivate? Are there ways we can interact that can cultivate it? And the goal that he had was to teach effective ways to improve functioning and well-being by focusing more on the positive. And he's written very extensively. A recent book he's written that's for the, not for a medical audience, but for the public, is Flourish. So that if you're interested in this, is a great resource. So he did these studies, and one that really intrigues me is when they looked at positive psychology exercises. That is when PPE did not mean personal protective equipment. It was positive psychology exercises. And so they looked at happiness interventions, things that they thought would make people feel better, with an internet study. And the PPEs they did were asking people to do one of three different exercises. One is to, once a day for a week, think about 3 good things in your life. The other, they gave people a computer test and identified strengths. And they said, okay, for a week, each day, we're going to ask you to take one of your strengths and do something new. So if you are creative, think of a new way to be creative. If you're kind, think of a new way to be kind to others, that kind of a thing. And then the third, which is my favorite because it's so straightforward and we could all benefit from doing it, are gratitude exercises. So they asked people at the end of the day to write about 3 things they were grateful for. Now they asked people to do this for 1 week, And they compared it to a group of people that were just writing about things they remember when they were younger. So something very focused and positive versus something that's neutral or could be negative. And what they found is that happiness scores were better at 1, 3, and 6 months from just doing gratitude exercises for a week. I think when you feel surrounded and overwhelmed, having time that you reflect every day on what you can be grateful for. This is something I have suggested. I do myself, and I've suggested so many students and parents and others just to be able to put some energy. It's really easy to see what's frustrating and hard right now. So good to put some energy into things that are not. Now, as far as relaxation techniques, all kinds of things. It could be doing progressive muscle relaxation where you tense your muscles and then release them. It could be doing yoga, if that's something you like. Meditation, more specific kinds of meditation. Visualization, where you try to imagine things that are calming and pleasant. Mindfulness meditation and training, where you really focus on your body and learn to focus on your breathing, focus on the environment around you, how it feels to be sitting in the chair, how it feels to take a deep breath, which is really good because it can reduce stress levels immediately. And so learning some of these techniques so you can employ them and use them, and students can use them when they're feeling more tense or stressed, especially going back into this environment. Exercise, which is really important. It gets rid of some of that negative energy. It reduces some of that adrenaline surge. It works it off in a healthy way. Now, as far as mindfulness meditation practices, there are all kinds of apps. And I'm not associated with any of them. I just think it's good to do something that's been road tested. So there's the Calm app, there's the Headspace app. There, you could just go and Google mindfulness meditation apps. I think the critical thing is it's called practices because they work when you practice them. So if you do them routinely and you take time to actually get better at them, then you can call upon them sitting in class when you're feeling nervous or in a meeting when you're feeling nervous. If you just have it on your phone and say, oh, I'm feeling nervous, let me call that up and see what I should be doing, it will not work. Now let's talk about the concerning element, the psychological responses to this pandemic that have been quite concerning. The CDC does pulse surveys all the time, and they do them routinely, and they've been doing them at least monthly, if not more frequently during the pandemic, where they ask questions about anxiety and depression. They use a standard short screen for anxiety and depression. I just want to show you the rates that were reported in the summer of 2019, when none of us knew what COVID was, compared to July 2020. The green is March 2021, and the red is July 2021. So yes, when we first had no clue and we were overwhelmed, that was worse, but it is still 3 times higher than the baseline rates. So the overall rates of anxiety and depression right now are 3 times higher than what they would normally be. And that rate of, again, this is not everyone has an anxiety disorder, but has enough anxiety you'd be concerned and you might think about having it evaluated. So we're running way too high, and it's been going on for a very long time. So when someone has anxiety, so let's take an example. You have a student, and the student is worried about something, having to give a big presentation in class, and they're really anxious about it. And the date gets closer and closer, and they get more and more anxious. They then have a moment where they're either going to engage in avoidant behavior, like, I'm going to get my mom to call the teacher and get me out of this. And if they do that, they immediately feel better. Oh, good, I don't have to do it. But then what happens is you've reinforced the idea that I really can't do that. I think it's going to be a disaster. I'm not sure I could ever do that. And then you just keep spinning this circle. Whereas right here with the avoidant behavior, you don't do that. You say, you know what? I'm going to manage it. I'm going to do deep breathing. I'm going to talk to my teacher. I'm going to figure out a way to give this presentation, and it doesn't have to be perfect. It would just be good. That has great benefits. Why? Because, these anxiety symptoms can be debilitating. The kind of anxiety symptoms we see with students include having excessive fear or worry that impacts daily life, often functioning in school and avoidance of school, feeling very physically restless, getting easily tired or fatigued, feeling more irritable or agitated, having muscle tension where you're just in your body, you're holding it, you're holding on to anxiety. When you have trouble sleeping, or as I was just talking about, you avoid anxiety provoking situations or activities. So what you end up doing is saying, I'm going to just try to keep myself safe. I'm going to bubble wrap myself and not have to do that. So what happens is with little kids, anxiety sometimes, and adolescents, it shows up differently. A lot of times with physical symptoms, somatic symptoms like headaches or stomach aches. Sometimes with avoidance, as I've talked about. Sometimes with saying, I can't go to school. Sometimes having trouble leaving mom or dad or babysitters because they feel more comfortable and safe if they're with them. Not being able to focus, having tantrums, having problems with changes in routine, which is all that's been going on for the last while, and needing a lot of reassurance. It's going to be okay. I'm going to pick you up at 4. I promise I'll be here at 4. That you're just having to frequently say that's going to be okay. Now, the issue with anxiety, and I keep mentioning avoidance, is you have 2 options. You can avoid, so essentially take yourself out of the situation so you don't have to deal with it, or you can learn to tolerate the distress. But the disability from anxiety disorders comes from avoidance, comes from taking yourself out rather than learning to say, okay, I'm uncomfortable right now, but I got through it. And next time it probably won't be as difficult. Okay, and build confidence and get some sense of mastery that way. Now, the other thing we're worried about, obviously quite a bit now in teenagers and younger kids and adults, is depression, as I said. So here we're worrying about people having a sad, a low, or an irritable mood, or feeling nothing. Sometimes people say when they're depressed, they can't have any positive feelings. So they feel, just like they're closed up in glass, or they can't interact or feel anything. Not enjoying the activities they normally enjoy, having changes in their appetite or their weight, sleeping more or less than usual, feeling really restless or slowed down. Now, most of the time people when they're depressed are slowed down, but there's a sort of bad energy or anxiety. And sometimes if there's sort of that tension, restlessness, people will find, and teenagers often find, alcohol or marijuana. And the problem is becoming intoxicated does change that sense of restlessness, and it changes feeling lousy, as people do when they're depressed or anxious. And so unfortunately, escalating substance use can be a part of having a depression or anxiety syndrome. Energy is usually bad with depression. Concentration is off, so that affects ability to do schoolwork or organize your day. And then the more serious symptoms include feeling guilty or worthless, or not feeling that you have value. And that's very tied to the most serious symptom, which is, of course, having thoughts about death or suicide, which is an emergency. It's always an emergency. Now, with little children, again, they sometimes can't articulate this in the way that teenagers can. So with younger children, we look for changes where they get picky in their eating. They're clingy. They want to stay with their mom and dad or trusted siblings, aunts, uncles, babysitters. They say mean things about themselves. No one wants to be my friend. They don't quite articulate it the way a teenager would, but they get very negative about themselves. They have regression, like they might start sucking their thumb when they haven't done that for a long time. They have separation problems. They're afraid of going to school. And they have lots of physical complaints. They get headaches, stomach aches, that if you take them to the pediatrician, they'll say, I don't think anything's wrong, or I don't think they're actually ill, but that the stress is coming out in that way. Now, with the teenagers, they're much more likely to have an irritable mood than a sad mood. So it's edgy. Now, some parents have said to me, my teenagers are edgy. That's pretty par for the course. This is more than that. There is an edginess, and there's an edginess not just with parents who might have to say no, but edginess with friends and favorite aunt or uncle or grandparents are usually fun for them to spend time with. Another thing that they'll experience is anhedonia, which is that inability to feel joy, excitement, or pleasure, feeling less hopeful about their future. And what's different between young kids and teenagers is that they are starting to think about their future. They're wondering about having one. And then if they don't see one, that ends up being pretty concerning. Social isolation. I'll often say with parents, the parents will come and say, my teenager doesn't want to do things with me. And I'll say, sure, you're right. They don't. They want to do things with their friends. However, when they don't want to do things with their friends, when they're dropping out of activities that they like doing, when they don't want to have a friend come over and, or go and spend time out, like right now, it's great weather. People are spending time outside with their friends and they don't want to do that. That's very concerning with teens. Substance abuse, as I mentioned, again, headaches, other kinds of physical complaints, and anxiety. Anxiety and depression are very co-occurring and intermingled with teenagers. In the midst of all the losses so many of us have, I wanted to take a moment just to contrast the way we respond to grief with depression, with major depression, the kind of depression that's a medical problem. Grief is not just death. Grief is loss. And I think actually a lot of students feel a sense of grief of losing the last 18 months. There are a number of students that, their senior year of high school, their first year of college was on Zoom. That's not what anyone wanted for them, and certainly not what they wanted. So grief can be broader than a loss, but we've also had a lot of losses. People have had serious losses with this terrible infectious disease. So grief tends to be really intense for a few months, and then it's still there for a year or sometimes two, if it's a really close loss, but it goes in waves. It's very rare to have suicidal thoughts. It is very rare that people start doubting themselves or feeling bad about themselves. They're sad. They maybe can't function as well, but they have periods where they feel okay, and these waves come and go. Whereas with depression, the negative feelings are there all the time. Sometimes they're more or less intense, but it's not that you get to have breaks from it, really. Suicidal thoughts can be part of it. And that negative feeling about yourself, what we call a self-attitude change, is absolutely there. So you feel, I'm a screw up. No one wants to be my friend. I don't like how I look. I don't think I have much of a future. Those really negative views of yourself, very common in depression and not in grief. So how are people responding to this crisis from the pandemic and now this new chapter where they're trying to add getting back to school on top of everything else? Well, some people are surprisingly resilient, and that is admirable and important to recognize. Some people are doing fine. Most people, in my estimation, are understandably exhausted. They don't have something serious going on, but they are tired, they're edgy, they're irritable, and it's a problem. And then there is a group, and I think as a psychiatrist, it's really important that we identify the students going through this and ourselves, if we're going through it, where you're more vulnerable. And this group, it's concerningly vulnerable because maybe they're starting to have symptoms at a level that the depression or anxiety is impairing and really needs treatment. So what should we do for the surprisingly resilient? Monitoring. And by that, I mean, pay attention and make sure they stay in that group, that they don't get tired or something more serious. It's not like once you're in one group, you're there forever. Obviously, I hope that the people suffering, we can get them feeling better. But if you've been doing great, you could have just one too many things happen and suddenly you're really exhausted. So I also think we should learn from them. If people are doing well, ask them what they're doing. What's your secret? What has really worked for you? What's helped to keep you going forward? Many of them will tell you that they've made time for exercise, time with friends, time with their spiritual community, and continuing to prioritize that's going to be really important. And I think for students, helping them find time for some of these other activities. All kinds of programs that support healthy behaviors. So being on a sports team or having a regular exercise routine, walking as a family, getting outside. And as I said, continuing to monitor so we know. Now, for the understandably exhausted, the biggest group, there, I think we have to encourage each other to spend more time relaxing, resting, recuperating, because you can't go full out nonstop. If someone's not exercising regularly, that's one of the easiest things you can add that can really make a big difference. Again, if you are not connected or dropped out of the connection with spiritual communities, getting back in time with that, making time to spend time with family and friends and organizing it so it's quality time, not everyone on a different screen. As a psychiatrist, I don't particularly like screens. Sometimes using specific relaxation programs like the Calm app, or breathe. One of my dear friends who's a nurse came up with this thinking about all the things we need to do. So let me tell you what breathe stands for. The first is to do breathing exercises. They can be simple, something where you take simple ones, 7 counts in, hold it for 4, let it out with 8, or you can do it 4, 4, 4. It doesn't matter, but all of them have, you take a deep breath in, you hold it for a little bit of time, and usually you're breathing in through your nose and letting it out through your mouth. So you just do some very slow, deep breathing. The R is for reflecting on things you're grateful for. So take a moment to do gratitude, exercise, accept things that are difficult and that you can't change. It's going back to the fabulous serenity prayer. Avoid alcohol is another extra A, because that has gotten out of control. And sometimes I think I've heard that some families got a little more loosey-goosey given that everyone was home. So it's time to be thoughtful about that again. Talking to a supportive friend, helping others and being able to ask for help. And this is going back to positive psychology, eliminating negative thoughts and replacing them with more positive thoughts. So when you get stuck in it's never going to be normal, we're never going to be able to do normal things again, we're never going to be able to be sitting in a movie theater without a mask, to say instead, we've made progress. It's great that many people are protected by the vaccine, at least to some extent. We're able to do things we weren't able to do more than a year ago. And then what to do for those you're really worried about, where you're worried this could be the kind of depression or anxiety I was talking about, where the symptoms are intense enough, frequent enough, and impairing enough that you want to do something. Well, that's where you say, all right, if you've already gone through depression, anxiety, we really need to be careful about this because you're at much higher risk. You can talk to the school counselor. Children spend a lot of time at school, and now that they're having school in the classes again instead of in your living room, I think it's important to realize that you have a partner there, someone who can get information and be thoughtful about how a young person's doing. If it's really concerning you, I can't stress enough that you want to get an evaluation with a mental health professional so that you have an objective person with experience assessing the situation and deciding what is best to do. And sometimes if someone is expressing suicidal thoughts, you're going to want to have an emergent evaluation. Suicidal thoughts are an emergency. And as a parent, you shouldn't be in the position. I think it's dangerous if you're trying to decide for yourself, is it serious or not? So what can you do to support your child with all of this? The one is that you can make time for conversations that are more than superficial. Now, teenagers are going to try not to have them. So you just have to try over and over and over again, but not haranguing them, but just saying, well, how's it going? How's it being back in school? And they're like, oh, mom, dad, come on. But just make time and don't look at your phone while you're doing it. Don't be reading the paper while you're doing it. Actually give your attention, your focused attention to your child so they know that you're serious, that you want to hear what they have to say. At times you have to be direct and ask about feelings of depression, anxiety. I think in a way this is easier right now because there are so many newspaper articles or so many television stories. This is out there. So you could start it by saying, I heard something, you've heard this talk. I heard a program where they were talking about how many people are going through depression and anxiety because of the pandemic. How are you feeling? Is that something that's bothered you? Are your friends going through that? I mean, you can start with the dreaded friends start and then get into them, but it's opened the conversation in a way that we didn't have it open before. And then finally, you can talk to the school counselor if you have concerns, because school counselors are great at getting information from the different classroom teachers and just getting a sense of how things are going, and their experience, they're professionals. And so they can do it in a way that's respectful. And in my experience is really helpful to the students rather than making them feel awkward. So just know you have that resource at your child's school. And so at this point, I am happy to take questions. Because this is a webinar format, I'm going to ask people to put their questions in the chat. We don't have a way for you to be able to ask them directly, but I will go in the chat and get questions, and then I'll be happy to answer them. For the person who said that they are a parent of twins, and to say this has been stressful is putting it lightly, I am also a twin. And I grew up with the tales of how stressful it is to be the parent of twins. So I applaud you for taking that on. So a great question. Please give suggestions about how to get your child to talk to a counselor. That is a big challenge. So it's a challenge because obviously the quality of that interaction will be entirely dependent upon the student, the child's willingness to engage and actually share what they're feeling. Because if they're not sharing what they're feeling, then it ends up being, it's not very helpful. And so I think one thing that's helpful is to explain why you want them to go. And by that, I mean to say, you know, I noticed that this anxiety is really bothering you, or I see that you're not able to enjoy things. And I think you can feel better. You know, you're putting it in context of saying, this is what I'm seeing. This is how I think you're suffering. And something I've said to my own friends and family, trying to motivate them, is to say, I think you're suffering when you don't need to. I think you deserve to feel well. And this is a way I think I can help you to feel better. So I hope you'll agree to do this. Now, sometimes you have to just take them and, you know, you have to take them and then hope that the professional there might also have some ability to engage someone. I've started many conversations when I've said, well, you know, what did you come to see me for? You know, what are the reasons you came to see me? And the teenagers will start with, my parent brought me. It's like, okay, well, what was going on that you think your parent was worried? Oh, well, you know, I'm failing chemistry. Like, well, let's talk about that. And so sometimes, you know, just getting them there is a way to start. There's another follow-up about that. And how can I assure teenagers that seeing a counselor or a therapist is not a sign of weakness and doesn't mean that there's something wrong with them? First, I completely agree with you. It is no sign of weakness. I think it's actually a strength. I think it's a sign of strength and intelligence to say, if I have something that's not going well and I want to get it to be better, that to me says you're smart. And so I think you have to be explicit. I mean, the society is not sending that message, unfortunately. Society still has enough stigma that there's a little bit of a, so you need to see a counselor. So I think for parents to say, I really think this is a great idea. It's like seeing your pediatrician. I think something's going on that might be a medical problem that's really, who's, you know, really smart about these things and might have some good ideas for you how you can feel better. But you have to start by modeling it. If parents say, oh my gosh, don't tell anyone you're going to see this counselor, or let's just keep this within the family, that is going to be a problem because the students are going to absolutely know what that means. Okay. So how do we deal with the stress of current juniors that feel like they are behind in regards to college? Yeah, that's a good question. I think that what I've been trying to talk with students about is that every junior in the country is feeling the same way. So for better or for worse, there's a pretty level playing field. They are the class of, I guess, the class of 2023, right? And the class of 2023, they were sophomores for a year, they were out, et cetera. And so, you know, they're dealing with something that every other person their age is dealing with. Not that that makes it okay. And then I think it's good to be curious and say, well, what are you worried about? What can we do? Maybe we could help. Should we look at some websites together? Should we see what they're doing for these applications together? Another great question. How do you help your child deal with feeling of loss of control and fear of change? Great question. I think I'm going to take this from the anxiety response cycle. One of the most important things you're going to want to do is model that it's okay to feel anxious, but just try. What you want to not do is to get in that pattern of rescuing them. So you're giving the message that they can't handle it, or they're not really strong enough to handle it, or that there can just be, they can't manage it. But I think they need to get the message from parents of, give it your best shot. What's the worst thing? So you don't get a good grade. It'll be okay. It's one presentation versus, oh yeah, we better worry about that because I think you're going to screw up too. But I think you're modeling it and maybe doing something with them, or sharing the ways in which you've maybe had a little bit, times that you've been anxious and what helped you. Like, I personally grew up with a public speaking phobia, which hopefully you cannot tell tonight. So, in that way, do that. A great question about how do you balance advocating for your child's well-being and supporting them and finding their own way. I think what you do is decide there's going to be a line where they're going to be in big trouble. So try to encourage them with the small things. And then if it's something big, like they're really not prepared, or they're going to fail a class, or something terrible is going to happen. And that's where sometimes you need to get advice from their teacher of, look, is this that big a deal? What I think is advocacy, if it's all the time, you eventually start giving the message of, I really don't think you can manage things, right? I don't think you're well enough to do things. So, there is a fine line. So I think if you can get some small successes with some smaller issues, that often goes a long way. So, question, what advice would you give to a mother of a college junior? He's been described as irritable about everything for the past year. I suggested depression to the mother. She is resistant to intervening because he's over 18 and away from school. So let's talk about the challenge of over 18 and away from school. Absolutely. But you can express concern. And again, you can say, I was reading something, I heard a presentation, it made me think of you, and it made me worried that things are harder for you than they need to be. And I think that that's the kind of information. I mean, I think if you can make it personal of, I heard this, I thought of you, it made me worry about you, and this is why I'm talking with you about it. Now, the other thing you want to do is know what the resources are. Because if someone is depressed or struggling, you need to be able to say, I know there's a counseling center on the campus. I know that at your high school, you can go talk to, Mrs. M, who's the great counselor, and you told me you really like her. You want to be ready with the suggestion of the next step, because when someone is not feeling well, or if it's nearby, you might even say, do you want me to find a place you can go, and I'd be happy to pick you up and take you, just to make it a little bit easier and show how supportive you are of doing it. Someone is saying, I would say express concern without shaming that person. Absolutely. Now, here's the basic thing. I don't believe it's shameful to have depression or anxiety any more than I think it's shameful to have hypertension or epilepsy or diabetes. I don't think any of these things should be shamed, but society doesn't agree with me. And so I think we have to make an extra effort to be kind and supportive and explicitly say, I know this isn't your fault. This isn't something that you brought on. This is something you're going through. I just want to help you and support you. But I think they're getting so many messages that maybe it is their fault or they have done something wrong. And depression itself gives you the message just from being depressed that you're a screw up and you're not doing the right thing. That I think being very clear, I don't think you've done anything wrong. I think what we're talking about now is something where it's not your fault. So a question about what if your child prefers quarantine life? That is often, I've heard that from a lot of parents where their child has a tendency toward anxiety, maybe an anxiety disorder, maybe not an anxiety disorder, but a tendency. So there you have to do small exposures to get back out of quarantine life. we all adjust, right? When I was a medicine intern, I was up every third or fourth night, all night working. I could not do that now. I'm older, but you just adjust to it. And the reason I say that is that, okay, you've been in the house all the time. Let's go out for walks. Let's go and eat outdoor at a restaurant or go to a park. Let's go and do a few things together so that you get more comfortable and actually remember that those things are fun. The other thing is that it has to be more exciting than what they can do at home. And so if someone is very caught up in what they're doing on a screen, then why wouldn't you be at home? You have power supply and this and that. So I think this is about little exposures. You don't want it to be, well, that's it. We're going out and we're never going to be in the house again. I think that's really hard. But I think introducing things that might be fun and pleasurable is a way to do that. So one other question, how do you support an anxious child who's lost interest in school? I think that's very difficult because I think sometimes anxiety blunts your confidence. And so you don't want to engage because you're worried about it. So I would get interested in that, talk with them. What are they doing? Ask them to teach you things that maybe at dinner about what they've learned. Ask them why they're bored, because it might be that they're just bored. But, I think the point is to make that more of a focus so maybe they get excited about it. But if they're really anxious, that's a time to maybe get more information about the counselor. Is it that they've lost interest because when they're there, they feel miserable? And if that's going on, that would be a reason to take a little more attention and pay a little more attention. This whole presentation with the slides will be posted on the website probably by next week. My outstanding colleague who does the editing is really speedy. And so I have confidence that will happen. That will happen quickly. So unless there are any other questions, I'm going to thank all of you for your attention, for joining this evening. And I really appreciate your participation. And thank you very much for joining us. Good night.